Navajo Nation Health Department's Executive Director, Dr. Jill Jim, was recently named a member of the Biden-Harris Transition COVID-19 Advisory Board. She worked in urban and tribal communities for 18 years, participating in nonprofit, state, and federal agencies. The advisory board will consist of many other leading health experts and will help influence Biden's decisions on how to manage the safety and accessibility of the coronavirus vaccine.
At the same time, it's clear that this vaccine, even if approved, will not be widely available for many months yet to come. The challenge before us right now is still immense and growing. And although we are not in office yet, I'm just laying out what we expect to do and hope can be done, some of it between now and the time we are sworn in. But so the purpose of this is to let you know what we're going to do once sworn in. And so there's a need for bold action to fight this pandemic. We're still facing a very dark winter. There are now nearly 10 million COVID cases in the United States. And last week, we topped 120,000 new cases on multiple successive days. Infection rates are going up. Hospitalizations are going up. Deaths are going up. This crisis claimed nearly 1,000 American lives a day, and nearly 240,000 deaths so far. The projections still indicate we could lose 200,000 more lives in the coming months before a vaccine can be made widely available. So we can't forego the important work that needs to be done between now and then to get our country through the worst wave yet in this pandemic, to reduce the spread, to save lives. So that's why today I've named a COVID-19 Transition Advisory Board, comprised of distinguished public health experts, to help our transition team translate the Biden-Harris COVID-19 plan into action, a blueprint that we can put in place as soon as Kamala and I are sworn in to office on January 20th, 2021. And we'll seek to add other members to this board during this bring additional important perspectives on public health and expertise throughout the transition. This group will advise on detailed plans built on a bedrock of science and to keep compassion, empathy, and care for every American at its core, making rapid testing widely available, more widely available, much more widely available, and building a core of contact tracers who will track and curb this disease while we prioritize getting vaccines first to the most at-risk populations. Developing clear and detailed guidance and providing the necessary resources for small businesses, schools, child care centers to reopen and operate safely and effectively during the pandemic, protecting both workers and the public. Scaling up productive life-saving treatments and therapeutics, and when it's ready, making sure an approved vaccine is distributed equitably and efficiently and free for every American.